Good afternoon. Welcome once again to your favorite newscast, CIDEB. My name is Jerry Galindo.
And I am Marian Jara.
The topic of today is dengue.
To understand this topic in a better way, dengue is an epidemic disease characterized by fever, pain in the limbs, and a skin rash, similar to scarlet fever, followed by scaling.
This is a viral disease transmitted by mosquitoes and prevalent in tropical and subtropical areas. Next, we have the story of Labro, a boy who was infected with dengue.
We will know how he was infected, the symptoms he has, and the treatment he is taking.
In addition, a group of specialists will give us information about this topic.
At first, I received a mosquito bite without thinking that it could be something more than a common bite. But after a couple of days, I began to present a severe fever, a raging along the middle part of the foot and on the legs, great pain, headache, and generally in the morning and at night, vomiting and pain throughout the body, mainly in the muscles and joints of the left arm, which was where I received the bite.
First of all, let's explain the clinical case, something quite important because it is an example of how this pathological picture can affect a citizen. As will be expected, when receiving an insect bite, no one will expect it to be a transmitter because of the history of the mosquito, which surely by the person that carried the virus. As it is established in most cases, active symptoms do not appear until later, when the patient begins to have headache, vomiting, fever, muscle aches, and rash, being irritation in the eyeballs, the only symptom not presented. However, it is expected that this may appear in the next 3 or 5 days. Therefore, the diagnosis will be 90% linked to the dengue virus, and with it, in the next section, we could propose more specific treatment routes. Now, the definitive diagnosis of dengue infection is made in the laboratory and depends on the detection of specific antibodies in the patient's serum, the detection of the viral antigen or viral RNA in the serum or tissue, or the viral isolation. There is no specific medicine for dengue, but you can follow lineaments like saying a healthcare provider if you develop a fever or may have symptoms of dengue. Tell him or her about your trouble. Also, rest as much as possible. Take acetaminophen, also known as paracetamol, outside of the United States to control fever and relieve pain. Do not take aspirin or ibuprofen. Drink plenty of fluids to stay hydrated, and drink water or drinks with added electrolytes. All of these will be useful in cases like this, but in cases of severe dengue with bleeding, you should see an doctor urgently or go to an emergency room to know what you have concretely.
Now it's important to talk about the kind of immune response that the body has in front of the dengue. In this kind of sickness that the body gets them from an insect, in this case the mosquito, the most common immune response that the body has is active. Why? Very simple. Because, as the name said, the immune system works actively to consolidate a response to the aggressor, that is the mosquito bite. So, this immune response happens when the immune system makes direct contact with the antigen, that, as we already said, is the mosquito bite. Okay, so now we have to talk about the importance of take care of ourselves with this sickness. Which are the best ways to protect ourselves? Okay, so the best way to prevent this disease is to protect yourself from the mosquito bites. Why? Because the mosquito is the principal cause of the dengue. So how can I protect myself? Well, with the mosquito repellent, that you have to use it in your skin when you are outdoors or in very humid areas. It's important to use it to avoid these mosquito bites. Also, there is a vaccine to prevent dengue that from the organization Dengue that is licensed and available in some countries for people who their age are from 9 to 45 years old. Also, the World Health Organization recommends that the vaccine only can be given to persons with confirmed prior of dengue virus infection.
How does the immune system respond? The infected immune cells display dengue viral antigens that surface which activates the innate immune response by alerting two types of blood cells called monocytes and macrophages. To to fight the virus. Normally, monocytes and macrophages ingest and destroy pathogens, but instead of destroying the dengue virus, both types of blood cells are transferred into the infection by the virus. The dengue virus tricks cells as the infected monocytes and macrophages travel through the lymphatic system. The dengue virus spreads through the body. During each journey, the dengue virus infects more cells, including those in the lymphadenous and the bone marrow macrophage in both the spleen and liver, and monocytes in the blood. The spread and increase of the virus results in the viremia, as we already mentioned. Although the dengue virus has tricked the immune system to infect cells and spread through the body, the infected cells produce and release small proteins called interferons that are part of the large group of proteins called cytokines. Interferons have the ability to interfere with the viral replication, and they activate both the innate and adaptive immune system defenses. They help the immune system recognize dengue-infected cells and help proteins unify cells from infection. As the immune system fights the dengue infection, the person can experience the symptoms of fever, fatigue, and also body ache. As the adaptive immune response starts fighting the dengue infection, produce B cells, antibodies called IgM and IgJ that are released in the body and lymph fluid, where they especially recognize and neutralize the dengue viral particles. In other adaptive immune response, cytotoxic T cells or killer T cells recognize and kill the cells that are infected with the dengue virus. The innate immune response activates the complement system, a response that helps the antibodies and white cells to remove the virus. Together, an anti-adaptive immune response neutralizes the dengue infection, and the patient recovers from the dengue fever. In summary,
with the case we saw today, we could realize how complicated this disease is. Right, Maria?
That's true, Jair, but thanks to the information provided by the specialists, we can be more informed about it and follow all the recommendations they gave us to avoid going through a similar situation as Lauros.
I agree with you, but right now, this has been all for today. I hope this new cast has been very useful for you. See you tomorrow. Goodbye.
Goodbye.